So as you can see, this is the liver. Okay. Okay. This is the liver. Okay. Now, this is the anterior aspect, and this is our posterior aspect. Correct? This is the posterior aspect. Okay. So, how do we know, and what are the main important thing that we have to identify, and what are the structures that will demarcate this liver? Okay, first of all, we have to learn what you can see from the anterior aspect is one ligament. Okay, this ligament is known as the falciform ligament. Okay, now this falciform ligament will demarcate the right and this is the right and the left lobe of the liver. Okay, the falciform ligament on the anterior aspect. Okay.
Yes, sir.
Next thing you have to understand is the falciform ligament will give the support to the liver by attachment, some attachment. So it will have the attachment with the diaphragm, and as it is on the anterior aspect, as you can see, so it will have some attachment with the anterior abdominal wall. Okay.
Yes.
Clear about the first ligament, which is the falciform ligament. This is most important. It's situated anteriorly, and it demarcates the lobe of the liver into right and the left, and it supports the diaphragm. It supports the liver by attaching with the diaphragm and also along with the anterior abdominal wall. Clear? Till now, are
Yes,
you with
sir.
me? Okay, very good.
Yes, sir.
Now, if you can see this superiorly and also on the almost on the posterior aspect a little bit, you can have one ligament that is this is known as the
This is
coronary ligament.
from
Okay, coronary ligament. They are known as the coronary ligament. Why they're known as the coronary ligament? Because they are almost shaped like a crown. Okay, crown shaped, and that's why they are known as the coronary ligament. Okay, what is the important of the coronary ligament is they will just simply give the support of the liver by attaching with the diaphragm itself. Okay, and on the right and on also on the left hand side, you will see there are some continuation of this coronary ligament, and these are some triangular in shape. Okay, on in the right hand side, also on the left hand side, you can see this is on the right hand side, and also in this left hand side, you can see there are some triangle shaped ligament, which are known as the triangular. These are
ligament.
known as the triangular. This is the left triangular ligament, and also you can see this area. This is the right triangular ligament, and also the right and left triangular ligament will give some support to the liver by attaching with the diaphragm as well. Okay. Everyone, is it clear about the ligaments? Falciform ligament, right and left, triangular ligament, upper and lower coronary ligament. Okay, is it clear?
Yes.
Yes.
Okay.
So can you
Now,
show the coronary ligament again?
Which one? Which one?
Coronary ligament.
Correct. Yes. This is your coronary ligament. Let me just hide this one. Sorry about this. Okay. Now I think you can see it clearly. This is your coronary ligament, upper and lower coronary ligament. Okay. Clear?
Yes, sir. Clear.
Okay.
Yes, sir.
Very good. Now, as I mentioned, the right and left lobe, anatomically, it is divided into right and left by the falciform ligament on the anterior aspect, correct?
Yes.
Okay. But if you can think surgically, how it is divided into right and left, so you have to know. You have to know one thing here. Then this is our inferior vena cava, correct?
Yes.
Okay. And if you can think about the fossa of the gallbladder. Okay.
Gallbladder.
Yes. So if you can make a line, okay, I can show you this in the image as well. If you can make a line from the fossa of the gallbladder towards the inferior vena cava, okay, as you can see, like this, okay, this will divide the liver surgically, okay, a line passing from the inferior vena cava to the fossa of the gallbladder. It will demarcate the liver again into the surgically. This is the surgical demarcation. Clear?
Yes.
Okay. So can anyone tell me what is the blood supply of the liver? Mainly it is by the
Portal vein.
Portal
correct.
vein.
Correct. And also it has some branches from the celiac trunk. Remember what is the branch I said?
Yes, sir.
Right and left?
Hepatic artery.
Hepatic artery.
Correct. Correct. So if they ask you what is the blood supply of the liver, that will also give the blood supply to the stomach. What you are going to say?
Common hepatic artery.
The hepatic artery.
Hepatic give-
The hepatic artery, because the celiac, it is coming from the celiac trunk, correct? And the celiac
Yes.
trunk,
Yes.
it will also have the blood supply to the stomach. So that's why they are going to ask you what is the artery of the giving the blood supply to the liver and also the stomach as well, which is coming from the celiac trunk. So our
That's
answer
right.
will be the hepatic
Hepatic
artery.
artery.
But the majority of the blood is coming from portal
Portal
vein
vein.
itself. Okay, now next question about the porta hepatis. Okay. Okay, before that, can anyone tell me what is the venous drainage of the liver?
Hepatic veins.
Exactly,
The
hepatic
hepatic
veins.
veins.
And the hepatic veins draining to where? What is the tributaries of the
Inferior
inferior vena
vena
cava,
cava.
right? At the level of
At the level of T12.
T8.
T8. T8. Yes, please don't forget. Okay, just always try to correlate everything. Okay, now about the porta hepatis, what are the structures you can have in the porta hepatis? So if you can think from
Portal
anterior
vein.
to the posterior, okay, from anterior to the posterior, you can think what you will have: the hepatic duct, the right and left hepatic duct, the hepatic artery, and the portal vein. Okay, the hepatic duct, the hepatic artery, and the portal vein from anterior to posterior. Okay,
Yes.
clear?
Yes, sir.
All right.
Hepatic-
Can anyone tell me what is the surface marking of the gallbladder? Where you can have the gallbladder? This is very easy.
Cartilages.
Mhm.
Fundus of the gallbladder situated in the tip of the 9th costa cartilage.
Okay.
Like the lateral border of the
Lateral border of the
Ask the patient to
rectus abdominis.
without
rectus
support.
abdominis. Okay.
The lateral border of the rectus abdominis on the right side.
Yes.
Identify the.
First of all, okay, this is a right angle between two lines. Okay. First line is, suppose this is the first line. This is the midclavicular line. The midclavicular line is also known as the lateral margin of the right rectus sheath. Suppose this is on the right side. Okay. This is the midclavicular line. The midclavicular line and also the lateral margin of the right rectus sheath, both of them are the same. So this is the first line, and second line you have to make, which will be having some right angle. This is our second line. This is the what line? Ninth. That is, it
costal
corresponds with the
cartilage.
9 costal cartilage, or what I mentioned. Correct. The transpyloric plane. So if you can make this line, this is the point where you can have the tip of the gallbladder. Correct?
Yes, sir.
Okay. Now tell me, why is there a shoulder pain in case of the cholecystitis?
In case of cholecystitis, it irritates the diaphragm, and the same root value that corresponds
What is
with
the root value?
suppressed
What is the root value? What is the root value of the phrenic nerve?
Cervical
C4, 5.
3, 4, 5.
5, C3, 4, 5.
3, 4, 5.
Five.
Okay. Here, first of all, the gallbladder is, if the gallbladder is inflamed, okay, whenever the gallbladder is inflamed, it comes in contact with the diaphragm, correct?
Yes.
Diaphragm. And the nerve supply of the diaphragm is the phrenic nerve. Remember, C3, 4, 5 keeps the patient alive. Okay. Now, when the diaphragm gets irritated, it has some pain in the shoulder tip. The question is why? Okay, the root value of the phrenic nerve is C3, 4, 5. And if you can think about the 4, from the 4, you have another nerve that is known as the supraclavicular nerve. And the supraclavicular nerve will give the innervation to the shoulder tip. And that's why you have the referred pain. If there is any kind of cholecystitis, you can have the referred pain to the shoulder tip. Now clear?
Yes, sir.
Yes, sir.
Okay, very good. Very good, guys. Okay. Among all of those things, the most important thing is you need to identify this picture. Okay, this picture. This is the most important thing that you have to identify, and you have to know this by your heart. Okay, let's first start with the gallbladder itself. Okay, and I will tell you why. So this is your gallbladder, correct? Okay, just behind the gallbladder, okay, gallbladder,
Quadrant block.
correct, gallbladder has R, right? And you will have this 21 is the
Quadrant
quadrate,
Quadrate lobe.
quadrate
Right.
lobe,
Lobe.
and the quadrate has also R, right? That's how I remember the quadrate and the quadrate, because you will forget where is the quadrate and where is the quadrate. So gallbladder has R and the quadrate also has R, so both of them lies together, but just side by side. So where is our quadrate lobe? So this number 2 is our quadrate.
Quadrant
This
lobe.
one is our quadrate lobe. Okay.
Quadrant lobe.
Next, as I mentioned, one thing is about the falciform ligament. Remember?
Yes.
Okay. So which one is our falciform ligament? As you can see, this one. So it is,
16.
you are seeing this picture from below and behind, correct?
Below and behind.
Yes, sir.
Yeah. So you can see the part of the falciform ligament, which is number 17. This is the falciform ligament. Okay. And on the sides, what I mentioned, you have some triangular, you will have some triangular ligament, correct? So this one, number 25, is your right triangular ligament, correct? And number 15 is your left triangular ligament. Okay, very nice. What else you have to understand is a very big thing that is that will demarcate the liver into the surgically. Okay, so first thing is gallbladder. We got the fossa of the gallbladder. Next thing, we have to identify the inferior vena cava, right?
13.
So if you can see this, this is our this is our inferior
Inferior
vena cava, correct? Okay, what else we have to understand is, if
Porta
you can see, yes, correct, the porta hepatis. Okay, so in the porta hepatis, we have to understand first of all which one is our portal vein, and you will see the largest structure. Okay, so number 20, this is our portal vein. Okay, all right. Next, we have to make sure that we understand another two things. One is number 5, which is our common
hepatic
this one.
duct.
Sorry, let me just change the color, please. Okay, this one is our common
Hepatic duct.
common hepatic duct, correct? Common hepatic duct. Okay, and on the side you will have this
Hepatic
11,
artery.
which is our hepatic artery. This is all about the porta hepatis. Okay, if you can go further a little bit, okay, so